Hi, welcome to Farm and Home. I'm Brandalyn Reddick, and today with us we have Dr. Julie Cerel. We're going to be discussing suicide prevention because September is Suicide Prevention Month. Dr. Cerel, could you please explain to us or help us understand the scope of suicide impact in Kentucky and why this is such an important public health issue?
Thanks for having me. So, in the US, every year we lose about 47,000 people to suicide. In the Commonwealth of Kentucky, that's a little over 800 people every single year. And so, when we think about the number of people that are dying by suicide, it's a leading cause of death for youth, and it's a top 20 cause of death for everyone. For everyone that dies by suicide, there's about 135 people left behind that personally knew the person that died, and their lives are impacted by that.
And you've spent your career researching and engaging in suicide prevention. So, from your perspective, what does it mean to think about suicide prevention as a responsibility for the entire community?
For a very long time, suicide was something that we didn't really talk about, or we talked about kind of in whispers. And that stigma really affects our ability to get people who are suicidal help and also to help people who are bereaved after a suicide occurs. And so making suicide a community issue means that we can talk about it, we can figure out ways to help people easier, and if somebody does die, then we can help the people left behind.
The University of Kentucky has made significant investments in advancing mental health research, service, and care. Um, so, what is something that people in our community can do to help further suicide prevention in their own communities?
So the easiest thing that people can do is learn how to ask people they're concerned about if they're suicidal, figure out how to persuade them to get help, and then refer them to help. And UK has actually invested in a program called QPR, Question, Persuade, Refer, where people can take a free 1 hour training and learn how to ask that really difficult question. Suicide isn't something that we can easily ask people a lot of the time. It takes some practice, it takes some doing, and knowing what to do if they say yes.
And how can people access this QPR training?
The QPR training is available online at ukhealthcare.com/QPR.
And what is something that people might want to know about suicide prevention training other than QPR? What else can they do to
I
help
think a
support?
lot of the time, right, I think a lot of the time people are worried that if they mention suicide to someone who are already worried about, they're going to put some idea into the person's head. And it's really never the case that someone is feeling so desperate and in pain that someone asking them if they're suicidal puts that suggestion into their head. And so that's not a concern. If you're worried about someone, it's really always appropriate to ask. If you can't ask, figuring out who can ask them, because caring about each other and being able to recognize that someone's struggling and getting them help keeps people alive and improves our communities.
So, for our viewers watching today who might be worried about someone in their lives right now, what is something that they could do to help?
So another thing that you can do is 988 is the National Suicide Prevention and Crisis Line. It's suicide prevention and crisis. So if you're in a crisis or you're worried about someone who you think might be suicidal or in a crisis, you can call or text 988 at any time, 24/7, and be put in touch with a trained counselor who can help you figure out how to help the person you're concerned about.
Thank you, Dr. Sorrell. Thank you for joining us on another episode of Farm and Home.